This introduction is just like the Eurovision Song Contest, but I will promise not to sing. Thank you for listening in here. So we're from Cercare Medical, and since I had to get up very early this morning, I made one slide just to make sure that I got all the messages across. We are spin out from Aarhus University. We were founded in 2013. The technology actually goes back much longer than that. We have a history of almost 25 years of research in this field. A lot of us also have backgrounds from Harvard Medical, and that's where many of the ideas originated from. The basic problem that we are solving is to enable hospitals to better manage the huge pressure on the healthcare system, and especially in radiology. So there's simply so many patients, and as populations are aging, this is going to be a compounded problem over time. We have spent the time the past years on building a network of key opinion leaders. So we are installed at many of the world's leading hospitals around the world. And we can do that because we already have regulatory clearance. So we have CE MDR certification, and we also have FDA clearance, and we are submitting 2 more FDA applications pretty much as we speak. The main indications for us pertain to blood flow in the brain, but also blood flow in other organs. And then we have one utility that's actually outside of the scope, and that's lower back pain. And you probably know that lower back pain is actually a bigger problem than all of these combined. We have also built a commercial base, so we are partnering with the likes of Siemens and Cercare and other really big corporations. So we have direct sales, but we also have partner sales, we have distributors and so on. And what we're going to do over the coming couple of years is to expand commercially. The product development is pretty much done, but we are going to expand in the US, but also in Asia and Pacific. So the intent, yeah, there we go. So we're looking at really, really big markets. Acute stroke, for instance, there are 15 million cases annually, and imaging is required. So it means that if patients come later than just a couple of hours, so 6 hours in particular, then you have to do imaging in order to treat the patient. Another indication for us is brain oncology, and we have already today heard quite a lot about how to image tumors. This is an imaging modality that does not require any radioactive tracer to actually see the tumor. And we have recently extended that to rest of body, so we can also image liver, breast, prostate, kidney, and so on. And then we have lower back pain. We didn't even commercially factor that into any of the budgets right now, but lower back pain, especially MRI, it's something you get if you have lower back pain, not necessarily because the physician has a suspicion of any malignancy, but it's important to be able to rule it out. And of course, you would know that this lack of radiologists, people who can actually read these brain scans or body scans, the radiologists are lacking globally, and that means that the waiting times are large, and it's basically a huge burden to the hospital, but also to society in general. And therefore, the market is also tremendously large, and I think the most important take-home point here is that we can actually be profitable with less than 1% of the addressable, serviceable market, and we can also become that in just a couple of years. So there is a definite need for this type of product. It's pretty welcome at the radiological departments, and that is something, of course, that has a big impact on the sales process for us. So I'll give you a quick view into what the solution looks like, and let's pretend that we are radiologists for a couple of minutes. What's really important for radiologists, for our end users, is first and foremost that it's an easy product to use. So if we were disrupting the workflow at a hospital, that would be very difficult to get such a product in. But we fit right in there, and we can deliver on premise. That's very important in Europe due to GDPR concerns. But in the US, for instance, we can already deliver via our partners as a cloud solution, and that's actually also a better model commercially. Then importantly, we can integrate MR machines and CT machines. And if you think about what that means for a radiologist, this is very important, because imagine that you have a stroke patient, and sometimes they will go into the CT scanner, sometimes they will go into the EMR scanner. And if that's two softwares, if that's two different workflows, it's a lot of extra training, it's a lot of extra time spent, and it's altogether very demanding for the physician. So uniquely, we can integrate these modalities, and you can basically send, as a radiologist, any brain, body, and so on scans to the software. And then most importantly, what we can do is that we can, without any operator interference, so completely automated, we can analyze these images, and we can do it sort of top down. So we can start with images that show something about where's the mass sitting, where's the tumor sitting, for instance, but then we look critically at blood flow. And the reason that blood flow is so important is that it turns out scientifically, and we have seen about 65 publications in our small company that demonstrates that blood flow is probably one of the main drivers of many of the diseases we see today. So obviously in acute stroke, where you have an occlusion of a neck artery, but also in oncology, for instance, and definitely also in dementia and Alzheimer's disease. So this is super critical, and we can integrate everything. And that's why this now turns into a platform technology where we have chosen to start with acute stroke and oncology, but there are many other directions that we can go in. I'm not 100% sure this, yes, it actually does work, so that's fantastic. Well, we wanted to show you why this is so difficult. Imagine that in routine clinical assessment, we have to figure out what is the blood flow through a capillary system. And more than that, we have to find out what is sort of the distribution, if you will, the heterogeneity of that dispersion of the red blood cells. And it turns out that the more sort of chaotic that distribution is, the less oxygen can be extracted from the capillaries. And that is something that we have figured out over the past 20 years, how to do this, and without interrupting the clinical workflow. And that's the big plus of the technology. So I want to give you just one example of what this does look like. So imagine here in the top row behind me, if you look in the acute stroke column, you can see, if you're a radiologist and you're sitting at a workstation and you're looking at, images from a patient in the scanner with severe symptoms, you would see the image in the top left, and it's basically, even to a trained radiologist, it's very, very, very difficult to extract information from it. They're like, pieces that are lighting up in front of the brain. There's some part of the tissue that's more or less missing, and then there's some left-right discrepancy, but it's really, really difficult to make a safe diagnosis here. And so what we can do is that we can basically take the same input from the scanner, and then we can generate the image in the bottom. And so I think, most people would probably agree, it's very easy now to see where the pathology is sitting in the brain. And we can do this in virtually a couple of minutes. So this is something that speeds up the assessment, especially of stroke patients. So that is very important. It can be in the order of 20 minutes per patient. So it's very, very significant. Another thing that's important, so remember I said that blood flow turns out to be a driver behind many diseases. So we often see that blood flow changes before you see sort of major physical signs of a disease. And one example is when you look in the brain oncology column behind me here. And again, on conventional imaging, so this is a patient from Boston, and this patient has a tumor that's been resected, and now you're trying, as you are treating the patient, then for instance with radiation, then you have to make sure that the tumor is not coming back and that it's not growing again. And if you look on the conventional imaging, you actually don't see any tumor movement. But when you look at the technology that we have developed here, you can see that there's a hotspot developing. So this is actually the tumor that's coming back. So this is very, very important, and something we utilize, of course, in the sales process. We developed this technology over many, many years. Actually, Leif Østergaard, that you can see here behind me, he pioneered perfusion imaging, as it's called, many years ago, working at Harvard Medical. And the competition is basically technology that's 25 years old. So this is a very, very attractive market. As I said, we already have the regulatory clearances in place, so we are approved today for sale in Europe with the MDR certification. We're also approved in the US with FDA 510K. And we recently got approved in South Korea, where we're already actively selling, and we also cleared in Australia. And then on the horizon we have Asia, we have China, and we have South America. So you can see here the patents that we have applied for have all been granted. There's one that's accepted and will be granted very, very soon. So this is our expansion strategy. I want to give you just a little bit of insight into the business model here, and you get a sense for what the price level is when you sell this type of medical software here. One thing that's very important commercially, of course, is that this is a recurring revenue model. So it means that we basically sell on 3 to 5 year, sometimes up to 10-year contracts. Also important that we can sell modules for CT, and we can sell modules for MR. We can sell modules for stroke, and we can sell modules for oncology, and then we have many other modules in the pipeline. Basically centering around the same technology, so there's very little development that needs to be done. As you can also see here, we have today a very, very low churn rate. We actually have not seen any churn yet, but we put in 10% because obviously that might be difficult to hold up. So you can also see we are a small company. We're about 38 people right now, and therefore we cannot in a direct fashion address the entire markets. So a couple of years ago we started establishing partner networks. We work with Siemens, we work with Cercare, we work with Cercare and a range of other companies, and then we work with distributors who don't have their own software that they are manufacturing, and that has turned out to be a very attractable model for us. So as you can see here, the rollout basically looks like this. So we are going to focus direct efforts in Europe, and then we are going to work with partners in the US and in Asia. And that would be the focus for the coming couple of years. And I just wanted to show you here sort of the footprint that we already have in the market. So these are sites where we already installed and up and running, or that are late progressed in the pipeline. So you can see we are strong in Europe, and then we are starting the expansion into other parts of the world. And here's a list of the partners that we have and the distributors that we have. And as you can see here, when we reach 25, we will basically be profitable when we expand on this journey. The competitive landscape also very attractive because we have a very unique technology. As you saw on the images, we're basically the only ones who can get to this level of detail where you can see the driver behind many diseases. And that's also what, on many dimensions, you could say, puts us in front of and ahead of the competition. So we're going to continue the commercial expansion, and I do want to orient you towards that we are doing a round right now. The book is pretty much full, but of course Jacob and the team will, I'm sure, be happy to take discussions if you would be interested. And I think, in conclusion, very important that this is a validated technology with approvals in place. The market is tremendously large. It's seamless and effective for physicians to use. And I think most importantly here, the business model is very, very attractive. Thank you for your attention.
Thank you very much for that.
Absolutely.
Yeah, so you talked a little bit about the market, and there's obviously a huge market potential. Would you like to elaborate a little bit about the drivers? What's driving this market that you're on?
Yes, so there is a trend towards trying to discover disease as early as possible and then as fast as possible, of course, also at one. And I think, the fact that we come in as early as we do is very important. And that's something that competing technologies is typically not able to. And just to give one example, we came back from a symposium in Germany just a couple of months ago. On one case, just to show you how this works at a hospital, a tumor patient comes in, but it's actually a patient who had a tumor 18 years ago. The tumor was resected, and the patient actually lived for many years. Then came back, a few months back with symptoms, and now, of course, the problem was to figure out is this new tumor recurrence. And so a scan was done with one of the big equipment manufacturers, and the manufacturer didn't see anything. didn't see any tumor movement. So the patient was discharged, and I think, it was pretty much the same week that Cercare Medical was installed, and they, tried with this new technology, and we could see tumor movement. So now, of course, that was confusion, and you had to decide in which direction to go. So the patient was readmitted to the hospital, and they did a DNA profile, so they did a biopsy and a DNA profile, and they could see that there was a 100% match between the most recent sample and then the one that was on store from 18 years back. So I think that somehow demonstrates the power of the technology, if you will, and how that factors into the sales process.
Very interesting. And about the sales process, would you like to elaborate a little bit about that? How do you make sure to reach out to your customers? And
So as you can see, by looking at, today's standard, the types of imaging that's available, I think, the contact would typically go that we would reach out, and then we would ask about, how perfusion imaging is already used and what the level of interest is. And usually what we find is that there's a lot of dissatisfaction with the perfusion imaging as it's done today. And then what's very important in our sales process is we don't have to go out and acquire new data. We don't have to install any new equipment and so on. So we can simply have the hospital send data to us, analyze it, and then send it back, and then the hospital can basically in hours compare with data they already have available. And I think that's one of the most important drivers in the sales process.
Interesting. So finally, I understand that you also have a spinal solution.
Yes.
Would you like to talk a little bit about that, because we didn't have time on the presentation?
I know. So that one is a whole presentation in itself. But very importantly, when you think about finding, we're basically looking at a blood vessel, and then we are looking for a narrowing in the blood vessel. And so that's a stroke. If you sort of rotate that and then imagine that's a central canal where the spine is running, then a lot of lower back pain also comes from some sort of compression in the central canal. So we can actually repurpose this technology very, very easily to address that, very big and in a sense very different market. And so competitors, and there's actually only one in the market, and then there's some academic interest, but they're based on a couple of thousand. It's an AI technology. It's based on a couple of thousand patients. We have already sourced more than 40,000 patients, not images, but patients, to build a solution, and we can see that we can get ahead of the competition on more than 10 indications completely automatically. So that's something that we would like to pursue in the future.
All right. We have, I think, 2 minutes left. Would you like to talk a little bit about the roadmap for the upcoming 12 months? What's highest on your priority going forward?
So one of the most important things is beyond Europe to establish a presence in the US, and we just opened an office a couple of months ago in Boston on Milk Street. So populating that office, supporting the big partners that we're working with in the US. Siemens, for instance, has a tremendously large install base, and we're also working with software vendors. So utilizing that network, and I mean, you would know how relatively difficult that can be, because you need to spend a lot of time training sales organizations, clinical application specialists, and so on. And that's basically what we are spending our time doing right now. So essentially, we are, magnifying the sales organization.
Okay, thank you very much. I think our time is up. Thank you very much for the presentation, and
thank you very much.
Around.